Welcome to Sports Doc Talk. I'm Will Sanchez, along with our orthopedic surgeon and sports medicine specialist, Dr. Grant Garcia. Um, Before we get into everything, we were really excited about this podcast and talking about this particular injury. But before we get into that, how are you? How's everything going? Memorial Day weekend, you're grilling. What's happening with you and the fam?
Yeah, so we're good. Life's good, the usual busyness. We actually like boating a lot. So we have a boat. So we're going to go on our boat and have a good time. But right now the forecast is like in the 50s and 60s. So for all of you not in Seattle listening to this, that's pretty normal around this time of the year. So unfortunately, we're not going to get the warm weather that we get every once in a while. So I think we'll do a little grilling, a little hanging out, family time away
Nice.
from all technology. So that's good.
I heard the weather's going to recover for this weekend, so the weather should be nice. But
Keep saying,
yeah. But speaking of recovery, let's see. Let's give Mike B and the rest of the fellas out there a shout out for the recovery shop. You know them better than anybody else. Tell us why you love utilizing
yeah.
them.
Yeah. So again, you guys have heard it nonstop. A big thanks to our sponsors.
Nonstop.
Honestly, for patients, this is the way people ask all the time. I mean, I had multiple patients even today from the office. They're like, "What else can we do? What's the next level stuff? I want nutrition. I want best rehab. I want the best machines." This is a way for you to get that. And so, as a surgeon, I can offer it in sort of one big pool website. You can check out my website on the recovery shop. Again, I get no cut from you signing up. So the key here is just that I really enjoy it. It's patients love it, surgeons love it. If you're a patient and you hear this, ask your surgeon about it. Ask them, say, "Hey, I want you to be part of this. I want to have the stuff that we can get. I want the extra stuff after surgery." And so it's a great opportunity. So reach out to Mike B. They're awesome. I think you really like it, and it's been a popular thing. And people have come up to me, different docs, saying thanks again. So it's awesome.
Yeah, it definitely is awesome. And, I've had my experience with them. So we always give them a thumbs up. We're about to get into the show and the topic that we wanted to really talk about, because it's exciting. And I feel weird saying it that way because you're excited about an injury. And that usually means that someone has gone through something very, very difficult. And we're going to talk about how difficult this type of injury is and everything that you have to do to recover from it. But we also want to let everyone know we've got a few submitted questions from some viewers, and we're going to tackle that on toward the end of the show. So just kind of hang tight. The one that we wanted to talk about is the Colorado Avalanche captain, Gabriel Landeskog. I mean, he's the type of player that most players either love or hate, but not too many players say that they hate this guy. I mean, he's an outstanding player, named captain at 19 years old, and just tells you the type of player he is and the hard work that goes into being at this elite level. So we're going to talk about he had this cartilage transplant surgery in May of 2023 and finally returned to the 2025 Stanley Cup playoffs after 1,032-day absence. And I mean, as we go through this all started with an injury back in 2020 with a skate going across his quad, right? And he had
Yeah.
this cut and this injury going across his quad. And we'll get into a little bit more about that. But just from that injury alone, would you have thought that it could have been into a situation where he wound up being in a situation where he had to recover the way he did?
Well, no, I mean, we've seen those type of injuries in the NHL all the time, right? Skates come across somebody, skate gets cut,
Yeah.
direct blow. I mean, these guys are getting hit really hard. And again, this is the first time in ever a player has had this surgery and gotten back to the NHL. And so as a result, no, I would not have expected that. But generally, these cartilage injuries they get, you're not really expecting them, right? Like you just
Yeah.
there's two real main types of these. There's the ones that are kind of like pre-degeneration, right? Because when you do this, the surgeons, I'm a cartilage restoration surgeon, similar to Dr. Brian Cole, who's my mentor. So our goal is to prevent arthritis. So we see cartilage damage and it's too early, so we try to replace it with other cartilage. But there's the acute injuries, which is probably here, which is a little different than when actually Lonzo Ball had, where you get an acute injury and then all of a sudden a cartilage hole happens and you can't save that normal cartilage. So now you've got to figure out a way to fix it or replace it or something. So this is more of a traumatic scenario.
And that's the difference between the type of injury that he had versus Lonzo Ball's.
Yes. I mean, again, without knowing either one of their knees, but just knowing enough of the story and having a lot of experience in this. I mean, this is really my main bread and butter is the cartilage stuff. This is what I love to do. This is why people come in and see me from far away. Like, it's the cartilage stuff. So I feel pretty confident in hearing, Lonzo Ball had a meniscus transplant, cartilage transplant. Never know what happens first. Is it the cartilage hole or the meniscus? Usually it's the cartilage, then the meniscus gets damaged. In this situation, we know what happened first because it was really just the cartilage damage. And so hearing we know when it happened, right? Lonzo Ball, you can look at different backstories on when his happened, but this one probably the direct blow caused some sort of cartilage damage, and they tried to get away without surgery for a long time. I mean, you can imagine these by the way, the word routine knee surgery means he went in there and someone did a cleanup. It was the same thing we heard about with routine knee surgery with Lonzo Ball. He had routine meniscus surgery. They mean routine cleanup. Right? That just means something really simple, just to kind of get something, a little bit of these pieces cleaned up. And then all of a sudden now they're not better, right? They're getting worse. And this is what we see out of our athletes in general, recreational athletes, but it's just rare that they end up needing something this big as a professional athlete. And we'll get into that in a minute.
So when you say cleanup, right, I'm going to take a step back, right? So we have this cut on the quad, right? And then what's happening, and please correct me if I'm wrong, because you're the doctor here, and I just
you play a doctor on TV though, so this is perfect.
Play one on TV. So you have the cut on the quad, and then you have this scar tissue buildup, right? And that's kind of what's happening there. That's when you, based on the pain or whatever else is happening, now you're going in to get this wear and tear kind of cleanup or scraping that's happening behind the kneecap. Am I kind of on base there as far as you're saying cleanup?
No, but you did describe what probably patients are thinking. So that's perfect. Okay. But I would say that that's probably not what happened in the scenario. I would imagine that he got skate and then had a traumatic injury and it knocked off a piece of cartilage, either dislocated the kneecap or just like a direct blow with the cut and then something like that. Generally, the scar tissue doesn't bring the damage, because scar tissue that builds up from that, unless he actually had a big surgery at the time, would not usually, even if you have scar tissue, it doesn't usually rubbing away the cartilage. And that takes years to happen. What I imagine is something like he got a piece lopped off on whatever part they had to replace of the cartilage. And then it was probably maybe small, right? And then he kind of lingered, or because right after that injury, he didn't get a scope. So if it wasn't a loose piece, they probably didn't recognize it. Or they may have got MRI, it was small. And then all of a sudden this happens. I said multiple patients in the last few weeks where 2 or 3 years later from this injury, they all of a sudden start developing more pain. And then this hole got better and more uncomfortable.
Okay. So then when you're going in for cleanup, you're just shaving down that area, getting it down to the surface now?
Yeah. So, I mean, it depends on what their goal was there. But my expectation hearing this, seeing simple scope, obviously mid-season, you don't want to knock the player out, right? But they're having pain and you're like, okay, let's try to give them some relief. So you go in there, 2 simple poke holes. And if Brian Cole did the first surgery, I know exactly what he did. So he went in there and he's going there with a shaver. We have talk about a little bit of haircuts, kind of like you do with the meniscus cleanups. And then you kind of smooth that surface out, because that cartilage as it's kind of flaying off. It can cause irritation as you're rubbing back and forth. So it is a very simple procedure, right? Probably 20 minutes.
Oh, so it's a quick procedure. So we're thinking more or less the timeline, right? So he has his injury in 2020. Obviously, with the pandemic, nobody's playing. So all of this time, he's not playing, goes back on the ice a year later or so. Pain is there, right? And then for this type of pain, your leg is straight, okay, but bending the knee, skating, things like that, you think that's where that's flaring up, with this type of knee pain? So that is constant, right? Are we talking about just a constant pain for a professional skater to skate left and right, stop on a dime, reverse, things like that? Go ahead.
Well, yeah, you're probably right. I mean, because the thing is that these cartilage holes are common in athletes, right? Like when we did the NFL players and we looked at MRIs of them and stuff like that, they have some bad looking injuries. We always talk about that. Like when I was doing the Giants and we were at HSS and we were seeing MRIs, I was like, oh my God, they were they'd cover the name and be like, how old do you think this guy is? And I was 45. And it's no, 22. It's oh my God, these are MRIs, they're getting beat up, right? So players have cartilage injuries, but generally we don't treat them this aggressively because it's just the NFL. We don't do those type of things, or we
Yeah.
haven't done them before. They're not time tested, or whatever you want to say about these different procedures until now. So a lot of players have these injuries. This scenario, though, it was obviously bad enough that it was time to do something else. It's the same way with Lonzo Ball, but we have to come with the caveat that this is, and I don't want to jump ahead to your next question,
No,
but
go ahead. Yeah, we're good.
when you have this problem, most docs, and I mean, we've talked about this ad nauseum. All these places I've gone teaching, talk to different team doctors. I saw the team doctor for the Jazz, talked to team doctor for the Dodgers, and they're like, "This is Brian Cole is awesome. Like the fact that he was wanting to be the first one to do this, and now he's done it twice,
Yeah, yeah.
right? So no one was willing to take the risk to do this surgery. This is not a risky surgery overall. I do almost over 30 of these a year. I do a lot of them. The patients do quite well. This is a very successful procedure, but never done in professional athletes because we don't know how it can handle the crazy high impact, right? We're just nervous about it. We can take that risk in someone who's a young athlete because it's been around for 15 years and it's got good data, but no one wants to be the first, right? Even in ACL surgeries, we do so many different types of ACL surgeries, but in the NFL, it's patella tendon, like 98% of them. Even Neil Altroz is one of the best in the world for sports doctors, does not want to do another type of ACL because the patella tendon is what the agents expect, right? So you've got to, we talked about this before, you're following old rules, but Brian Cole, right? He's the master of cartilage. He's the team doctor of all cartilage for all different NFLs and NBA and you name it. He says, you know what? I don't care anymore. I'm going to do what I think is the best thing for the player. And it's going to take a long time to recover. I mean, 1,000 days for both surgeries is a long time for recovery. I mean, that makes the Tommy John look light.
Yeah, yeah, and we're gonna, and I have some questions about the recovery. I'm just kind of going through the timeline now. So he went in there, they cleaned it out. Obviously, the pain didn't go away. I can imagine how many times they consulted with the Colorado physician doctor, with Dr. Cole, with agents, with Bob down the street, and the family. Yeah, everybody that has to go into the decision to say, okay, this is not working. Our captain is not healed. We need to now go into another procedure, and we have to go into this type of procedure that we have there. Why don't you describe what that procedure is and what this entails?
Yeah. So did you, I want to double check. Do we confirm that he got a tibial tubercle osteotomy, or is that what you, did you read that?
Yes. He had the osteochondral allograft. That's one part of the procedure, right? And then the tibial tubercle.
This is really interesting. Well, this is great. So this actually adds another little wrinkle to this because it's different than Lonzo Ball. So Lonzo Ball had his on the in and outside of the knee. Do you guys see those? Those are the two areas. Now remember, this is a this is a AI made knee that Will designed. So this is a little different animal than what we normally see. There's no patella on the front of that, right? There's a kneecap that's supposed to go on the front. So this is kind of like taking that off so you can see what's going on. But what Dr. Cole did here, and this is something I do a lot, is he probably replaced either the trochlea or probably the patella, which is the kneecap, with a cartilage transplant. So that cartilage, that plug, it doesn't stick out like that. That's just showing you how it's going in. The bad cartilage underneath is cored out like woodworking, and then you core a fresh piece of cartilage from someone who recently passed away, someone quite young, unfortunately, and then you plug that in there. You have no usual screws. Just actually press it in sometimes. Sometimes you have to kind of slightly tap it in. And then they had to shift his kneecap, probably because I'm imagining this quad thing caused his patella dislocate, and it probably overloaded that. So he did the tubercle osteotomy to shift him over, which is pretty awesome that he was able to do this and get this guy back to the NHL. But a tubercle osteotomy with that is no joke of a surgery. But again, this is the same guy that got an NBA player back with a meniscus and a cartilage transplant. It's like, why not go small your first time? But they did not. So both of these are legitimate surgeries, and we know both players got back. So it's very impressive. But that obviously adds to the timeline, right? Like if it was just the cartilage transplant, the length of time is still there, but the overall initial period is not as difficult. The tubercle osteotomy adds definitely a level of complexity to it.
So you're taking this piece and then you're adding the donor piece, right, to it.
Correct.
And that's where you're filling the piece that's either been rubbed off or scraped off. That's rubbing. That's giving the pain. You're adding
Usually
this.
it's a focal defect though. It's not like the whole thing's rubbed off and you've got arthritis. It's
Say
just
that
there's
again.
one hole.
Say that again.
It's it's not like you're it's not like it's the whole thing is damaged, like the entire kneecap. It's generally like a focal piece, right? There's like imagine it's a pothole. You have a pothole in the grass. So you're not going to replace all the grass because you won't be able to do that. So you core out and you get a fresh piece of sod. What's interesting though, it's similar to the sod. You have to have the dirt, you have to have the roots, and you have to have the grass. The grass is the cartilage. The lower layer is like the cartilage to bone layer, and you need the bone too. Because what happens is, what's really cool about these cartilage transplants is even though at a year, if you get an MRI, you can't really see the difference, it's actually the scaffold the old person's cells leave. And if you were to scope them, sometimes you still see the ring like a year or two later of the cartilage plug, but it lives on its own. So it
Okay.
grows into its body as like a transplant. Now, sometimes the ring closes, but usually you can still see that very faint line of where you put the cartilage transplant in. So within a few weeks, it's growing on its own. And so it doesn't need to grow back cartilage, which is pretty cool.
This is a nasty injury, right? I mean, this is a
No,
nasty
this is
scar. They're going from the
this
quad, and how far are we looking at a 10, 12-inch incision? Like, what's the
yes,
nastiness here?
like that. That's how big mine are for this one. I mean, they're big. They're 10 centimeters, maybe 6 inches, 8 inches. This is no joke of a surgery this guy
That
went
is
in. I
nasty
mean, this is
rough.
typical tubercle osteotomy with the cartilage transplant. Now these though, but like Cole's not going to do that unless you absolutely needs a TTO, right? Like I never do a TTO unless you absolutely need it. So they're basically breaking off part of the kneecap and shifting it to take off the load
Man,
off this cartilage transplant. But here's the thing. Dr. Cole's so good, and people and cartilage, when you do cartilage surgery like this, he knows that if the best shot for him to get back, if he thinks this is a spot, imagine like the kneecap is out of whack, right? It's not in perfect alignment. So if he does this transplant, there's still a lot more load on it. So the only way to fix it is to offload it. So to offload it, you need to do this shift of the kneecap, and you can't. In order to permanently shift it, you have to actually change the bone, right? Because the bone is connected to the patella tendon, which is connected to the patella, which is connected to the quad. So he probably got like hit, smashed his kneecap, broke off a piece of cartilage. They took it out, or it was not really noticeable at the time. And now all of a sudden he starts having pain. They rescope him in 2022. He's
yeah.
not really getting better. And then Cole's like, screw this. Let's just do this because you're not getting back if we don't do it. Right. It's like, I don't think that he was given too many options. He's like, either we're going to do this and you're not going to get back, or we're going to do nothing and you're not going to get back. And so that changes the perspective of this.
If he's a professional athlete, without knowing the level of pain, which I'm assuming is extreme, are you
This is
doing?
an NHL player. These guys, I no offense to the other athletes, these are the toughest.
Yeah.
There's no way that this was not painful.
But if you're not that level of athlete, are you still doing this on someone like me, or someone like you, or you're going, well, this is the type of surgery, and we can make it comfortable enough, or is it something like, no, you would do this anyway?
So I would do this anyway. I mean,
Okay.
I've done more than 10 of these surgeries in the last 6 months. So this is not something that this exact procedure. So this is not something that I don't do and I wouldn't indicate. Generally, the age cutoff on this, 50 and below, roughly, is kind of the timeline. But
Yeah.
it depends on the cartilage, right? If you've got great looking cartilage, but the average for this probably in their mid 30s, which is, I don't know. I'm assuming that he's a bit younger. But when you're younger, you gotta think about doing this, because the problem is if you leave this cartilage hole, not only does this guy get pain, and obviously we have to realize this is an athlete discussion, right? Like I can talk to you about in the office, which we'll get to in the patient questions. Like the patient discussion I have with him outside of being a professional athlete is like, do you want to have a trash knee in 10 years? Right.
Yeah.
And to be honest with you, for a lot of the athletes, it's sad, but they say, I don't care. I want to play for 2 more years. My contract's up. Right. We talked about with the Tua thing, and we talked about with other players.
Yeah.
This is a discussion now where it's like, do you want to play longer potentially, and do you not want to have a trash knee? So it's kind of cool that we can start saying that, like, hey, we can save your knee, because we know these cleanups do nothing. I mean, the cleanups are like, they buy them like 6 months, they buy them a year. I mean, I've taken for some NFL players. I had a guy that kept getting meniscus removed, and they said, you're just going to do a cleanup. And eventually he retired from the NFL, and we had to do a much larger surgery. And so as a result, we try to do Band-Aids on these athletes because the big stuff, if you do it and they're out for sure, then you also have the legal liability, right?
People are not doing the Dr. Brian Cole. Yeah, it's a whole other level, right? That's what you say. Like you're putting the Band-Aid on it and kind of getting them through, and then eventually you get a scenario and in the right situation where you have a doctor that goes, "This is what we're gonna do," and because it's who he is, they're going, "Okay, we trust what you're doing."
I imagine that this is not going to be, we talked about this before. Remember, I mentioned to you about the Lonzo Ball.
Yeah,
This is not going to be the last time this surgery is done now. You have now 2 successful athletes
but the
that have
standard.
gotten back with this surgery. And this is really interesting for the viewers. This is actually resonating with patients. I had a patient I did a cartilage transplant on. He exact same surgery
Yeah,
and the TTO. He came to me last week and he said, "You know how I knew I could do this?" He's like, "It was really scary sounding. I give them all the expectations. I say, worst case, best case. No matter what I tell them, if I say, feel comfortable with this, show them video testimonials, they don't care. It's scary," which is totally legitimate, right?
yeah,
Surgery is scary, Will. You know this. We
yeah,
both had surgery. He said this particular player helped him get back because he said if he can get back in 1,000 days, and I think I'll get back in a year, that doesn't sound that bad. And he said that this motivated him hearing about this story. And this is exactly why I wanted to do this podcast. Actually worked out
yeah,
that we got a little bit delayed in doing this because we was able to have these patient conversations. But
yeah,
that's the second time I've heard this. The Lonzo Ball one comes up all the time. I mean, I've had players, people being like, "Yeah, I know what it is now. Lonzo Ball had it."
yeah,
And it
yeah,
makes it
yeah,
so much. I think for people listening, they're like, well, when someone tells me they're complaining, they're saying, "Hey, 6 months sounds like a really long time to get back." I'm like, it took 2 professional athletes 1,000 days. I'm telling you, I think it'll take you 10 months. They're like, that's not too bad anymore, right? It sets
yeah,
a new bar,
yeah, yeah.
right? Like, and oh, by the way, it's not that 1,000 days means there was something wrong with his recovery. It's just that going back to the NHL,
NHL
I
level.
think this will continue to get, and also this will continue to get faster. I mean, Cole's not going to let them go back until he's absolutely. I'm sure he had like 6 MRIs to make sure it looked good,
Yeah, yeah,
right? Like everything's getting checked, make sure it's healed perfectly. Like we're not always doing all those things in the standard practice because, to be honest with you, if we don't, you can't just do an MRI for free, and so as a result, patients are
yeah,
paying for it,
yeah.
and they're not going to do that unless they really need to. So it's different than this stuff. I mean, these guys they have this print MRI machine. They're like, every day, every week that someone gets injured, it's like X-ray MRI, X-ray MRI.
I know how, and you touched upon it right now, and that's why I'm thinking about it. I know how I felt with my surgery, post surgery, and I know how I felt one day to the next, gun ho, ready to tackle the world. Let's go. Other times, just laying around, seeing atrophy kick in, seeing my family, being reliant on them, just everything. And you just go into this mental depression, and you're trying to kind of forge through it. For these athletes, that this is their career, their livelihood, you've worked with athletes. What is that mental aspect that the athlete is going through that you've experienced at the professional level with an injury like this?
I mean, it's a lot. Like when we get injured, we're like, okay, in a couple of weeks we can go back to doing our jobs, right? This guy's not doing his job for 1,032 days, right?
Yeah.
Or and in Lonzo Ball's case, he had a lot of guaranteed money, so that helped, I think, a little bit, if I
Yeah.
remember correctly. But that's not the way some of these contracts are being going on now, right? You can, if you're an amazing player, you can really dictate how your contract goes. So there's just a ton of stress, right? Like they came used to this thing, they got injured, and you get an ACL surgery, you're back in a year-ish. You get a meniscus cleanup 6 to 8 weeks. All of a sudden, now you're talking, it take you 1,000 days to get back,
Yeah.
right? That's like a humongous factor. And even though you're going through it, now you're like, I'm the first guy to get this. Like this is not a surgery without complications. 32% of these patients end up needing a cleanup at some point. And
Mm.
Brian Cole's written half the articles on it.
Well,
So there's a chance that Lonzo Ball and Gabriel will need another surgery. Now, again, that's the general data. I think that's a lot lower in my practice. And I know I'm sure Cole's, we didn't see that many cleanups, but there's a risk with it. So you're going through this whole recovery, trying to get back, and you're like, I really hope the cartilage transplant works, right? I really hope that the osteotomy heals. And then I hope I don't have pain. Oh, and then like I'm past that point. Now I hope I can like skate. Now
yeah.
I hope I can skate without pain. Oh, wait a second. Now I've got to play in the NHL, right? Like it's just not the benchmarks are my patients generally, and I mean, we get the professional athletes, it's different, but the general athlete, right? Like I'm bouldering again, like I'm back to running and doing some squats, and that's already impressive for this type of surgery. You know, that's the next level they have to get back to. So mentally, yes. And when you get to a certain point, even Cole's going to say, "Well, you're the first one, so we don't really have a benchmark to
Yeah,
when you're
you
going to
are the
ready to go
benchmark.
back." That you are the benchmark.
You are the
You're the new
benchmark.
benchmark. So um, it's a lot, and the mental aspect of this is humongous. I mean, it's more than that, right? It, I hate to say this, but the athletes are more of the head cases, and it's real. I mean, we know the mental anguish of athletics. We know the mental anguish of coming back from injury. We know the mental anguish of the pressure, right? It's real. It happens to both male and female athletes. I
Mhm.
tend to think that the female athletes are more vocal, which is great about the pressure they're feeling, and males tend to bottle it up, and that's a problem. We've seen that as well.
Yeah.
Um, but the mental aspect of this is humongous and probably the bigger part. And we talked about this ad nauseum, and we know we need to show about this. And it's just it is absolutely humongous. And I will tell you that this is real for my patients, absolutely real. I mean, I have patients that I tell them they need this surgery, and they're in terrible pain, and they need to get back to what they want to do, probably similar to the way he was. And I say,
Yeah.
you need a TTO, you need a cartilage surgery. It's going to take you 10 months to a year. And that's obviously a lot lower than the 1,000 days. And you just put their hands in their head and they say, how am I even going to handle 3 weeks of not working out? Right. Like that's
Yeah.
a humongous difference.
Yeah.
In the end, they're usually pretty happy. And I'm sure Gabriel's pretty happy, but there's no way you can't tackle that in the first visit. You can't tackle in the sixth visit. You got to just say, hey, listen, and we're probably going to jump to our question from the audience or from the viewers. I can't get you through this in one visit. I can get you through the process though. I'll be here with you the whole time. My team will be here with you the whole time. And so at 6 months to a year, you know, how am I doing? You're doing great. How am I doing? You're doing great. I think it's time to rip. Thank you. Like I'm ready. Like they get there. And it's usually for them in this case with these type of surgeries, it's usually 5, 6 months. So it's not the first few weeks. You're like, I think it
Yeah.
worked. I'm doing great.
Yeah. Yeah. Now, yeah, I got one more question before we get to a submitted questions from our viewers. And it's funny because I was thinking about it. I was like, would this have been possible 10 years? And I go, wait a minute, that's not even the question. It's like, how far? Like, would something like this have been possible 5 years ago? 3 years ago? And I know and it's probably a two-part question, right? One, for someone like me getting the surgery, and now we're seeing it now for professional athletes. So it's just happening now. But as far as technology and where we've come, where this surgery would have been possible 5, 10 years from prior.
So it would have been possible. Remember, we just need a lot more data and we need someone who's willing to push the envelope. So, you know, Brian Cole, when he's 25, 30, or 40, and he's, I hate to say that that's young surgeon, but when he's doing that, he's not ready to push the envelope, right? So you have most of these younger team doctors, they're not going to start doing that stuff. And they're not going to get the high level player anyways. They're going to Neil Altrosh, they're going to Brian Cole, right? And then you get someone like him who's a cartilage master and he finally gets to push the envelope. And so now we're able to do it. But he's got to see thousands of these, hundreds of these patients before he's like, I think it's time to do this in pros because this is ridiculous. They're not getting the care my other athletes are getting.
Yeah.
Right. My D1 college player that I did a cartilage transplant on, he's back to athletics. Why am I not use this on the pros? And so the technology improved, yes, over the last 5 years. We've had this surgery 5 years ago. There is definitely better stuff that we do. And what I did 5 years ago for this surgery is different than what I do now.
Yeah.
I would say not enough that it would have changed my decision to do it a pro athlete now versus then. I think it's just that Cole's built up enough clout that like if anybody were to say like, well, why did Cole do it? Be like, of course he did. He wrote the book on it. To be honest with you, Cole designed the system that he probably used. I know he did for Arthrex, the cartilage transplant set that he used to do his transplant and Lonzo's ball. So this is a master. Like he's got the whole system already designed and made to make it work for him. So if anybody says anything, it's like, this is the guy. Like if there's anybody that's going to do it and do a good job, it's him. So like you only go down from here in terms of what other options he had.
Anything, I know you've done this procedure, anything coming out, whether it's, donor or equipment or anything like that that's coming out? Because I know you go to a lot of conferences, you're in the conversation with a lot of these companies. Is there
Yeah.
anything exciting out there that maybe it's not today, but down the road that you can see that when it comes to surgeries like this, that you may be excited about or you're
Yeah.
hearing rumors about?
Well, really, everything's just to be heal faster, right? Is there biologics that we can enhance the healing of this graft, or can we grow things? Because the issue is when you have bone and cartilage, it's a lot harder to grow back, and especially in the patella, because less things are approved for the patella than they are for other parts of the knee,
Yeah.
right? So if you have a patella, do we have newer techniques that have better results in the transplants to fix bone? And we're going to get there. There are a lot of things in Europe that people are trying. And do we have a way to make this a faster recovery, right? Can we get this cartilage to grow, integrate, and be ready to go in 6 months? Can we do the typical osteotomy and double the bone healing time? Can we not use metal screws and use screws that turn into bone and no longer have that?
Mhm.
Yes, we are getting there, but we are definitely not there yet. I think in 10 more years, there'll be a situation where this guy will have no metal in his body. He's going to have he has metal screws from the tubercle osteotomy. There's no way about
Yeah.
that. And he's going to have, his cartilage will be either grown by itself with the bone or, something implanted where it just turns into cartilage and it's like a 95% success type of thing. Probably not 5 years from now, maybe 10.
Yeah.
But we're going to keep getting better. And it's going to take guys like this to show that this surgery works, for people to be like, well, wait a second, we've got to start doing more of these.
Great. You just mentioned three possible things, even though they're not here right now, but it's already, something that people could think about. All right, let's take a look at our viewer submitted questions. For those that are not watching, I'll read it out loud. One of the questions are, how much the medical field of orthopedics have changed over time, even with the physicians focusing on only some parts of the joints, such as wrists, hands, shoulders, or knees, from when you started to now?
Yeah, I think these are very broad, open-end questions, but I think really the key here is to say that over time, more surgeons have gotten more specialized. So, when we came out of practice with that fellowship training, we used to say, hey, listen, we're going to do general orthopedics, right? We're going to see hips, we're going to see knees, we're going to see mom and pop injured, we're going to see that. When you go to a city, which is different than if you're in a small area, very small town or something, in the middle of the country or somewhere else in the middle of the state that's not the big city, that still kind of works. But when you're in a place where you're in a big city, such as myself in Seattle, you have to be ready to take on the difficult things, because the cases that are more difficult, generally you don't see that many of them if you're not highly specialized. And so basically what happens is I see a lot less of the basic stuff. I still do tons of basic sports stuff, but I've
Yeah.
gotten so specialized that there's really big topics that I will take care of and I will see a lot of, like literally 95% more than most people in the whole area. But there's also things that I'll see very little of because I just don't do those things anymore. Right.
Gotcha.
And so that helps the patients, right? I don't do those other surgeries. I send them to my partners, or I send them somewhere else. You don't want me to do the surgery for you. It's not my specialty. But then when it's something really hard and really specialized, like something like this, like you
Yeah.
don't want someone dabbling in this surgery that he had. That is not a dabble surgery. I've seen these go really poorly when you don't know what you're doing. So something like this, you go find someone that does a lot of them and you get the best person to do it. And then you get a good result, because when most surgeons do one of them every 10 years, over 2 years, some surgeons, the high volume ones, again, minimal, but
Yeah.
there are people out there, do 12 times more. So then that makes the best sense. So that's really how it's changed. And then those people also spend their time designing, helping get the products better because they're higher volume and they get to see more, right? Like if you design something new and you don't get to try it for another year because you haven't seen somebody, like that's
Yeah.
not good, right? That's just not the way it works. We always know about this. Every data point shows that. So
Yeah, and it's great just from the amazing guests that we've had, like a Dr. Denard and shoulder specialist, and some of these other doctors that we've had, Andre Schaefer, right, back specialist, so just that kind of,
more to come.
yeah, more to come, but they're amazing at what they do. So it's just a prime example, kind of like this is their specialty. And I'm glad that you made a reference to that. I do these, and when I feel like there's someone better, I'm going to point you in that direction. And I hope that other doctors are doing the same way, because that's the type of care that we want. All right, let's take a look at our last submitted question for today. How do you, as an orthopedic surgeon, help decide and prepare your patients who are needing to have surgery, even when the surgery may change their lives physically? And that's a really good question. I like that one.
So it's kind of the same thing we talked about. I mean, you have to address both sides of the question, right? You have to address or both sides of the patient. You got to address the obviously the fear. I guess there's maybe three: fear, the pain, and expectations, right? And all those things have two components to them. They have the physical component and they have the mental component,
Mhm.
right? So when we address them, the first thing I like to do with my patients is I give them sort of the expectations. So what you're expected to do on average. That's from a timeline recovery, pain recovery, and success recovery. Then I'll talk to them about, like what you're going to be at, right? And I don't go into too much detail about your mental stuff at that point because every person's different, right? There's patients at 6 months that are doing really well and they just don't have a good mental attitude, which is not their fault. It's just the way their recovery is. And
Yeah.
each person's wired differently. So
Yeah.
that person needs less discussion of how their knee's doing and more discussion about how their head's doing. Some people come in and they say, my knee's doing really well, but I'm just worried about it. And those people need more like, okay, physically, you're doing really well. And then they get better, right? And there's a third type that maybe aren't doing as well physically. They need to focus on the physical and less on the mental. Like I'm telling them, you're doing well or you're mentally not there yet. Physically, let's figure out what's going on. Do you have
Right.
another complication? So that's really how I manage it with the patients. But the biggest thing is consistency, honesty, and full explanations. The number one way that I help patients prepare for their surgery is by spending countless hours, one in the office with them, but two, all that stuff on my internet, on my website. The videos on every single one of these surgeries and how I do it. I have spent hours making the videos. I have blogs on them. I have discussion points, you name it, video testimonials. Pretty much every surgery, there's a testimonial from a patient that's done it, doing well. There is articles published on there. There's a surgical video of how I do it. And there's a blog video of me describing it, plus the website. So when you get in there, there's no questions what you're going to do. My patients are super informed. Now, they may be overwhelmed on the first visit because this is like a lot. I mean, you can imagine talking to someone about this, but that's how we prepare them. That's how you should prepare the patients.
And they can check out your website at grantgarciamd.com. And then if you want to get in touch with us, check us out at sportsdoctalk.com. All sports, all orthopedics, all the time. We've got patient information, podcast information. Check out our transcripts. We want to hear from you. We're always looking for show ideas. Although I think we're pretty booked the next couple of weeks. We've got a lot of folks there, but we
I
still want to hear from
we're
you there.
booked for a few more than a few weeks, Will, but that's
I know I'm
okay.
trying to, I
Ping
don't want to
us.
discourage people. Let's keep
Don't
them all
discourage
coming
you.
on.
Ping us, and also depends on certain topics. If there's something you want to do, we've gotten people's topics in.
Yeah.
We've had guests that we've been able to sneak in. I mean, again, we try to load it up so you guys have always some good shows coming up. There are a lot of good speakers coming up, but it does not mean there's not a space for you on the show.
100%.
But I will say there are people we turn down because it doesn't fit the mold. I want to make sure that if someone's on the show that the listeners can hear. So we are fairly picky about our guests, but we've had some awesome guests that have come out of the blue. I mean, Tom was amazing.
Yeah.
Dr. Dave was amazing. So we have a mix of everything. And you're never, just like you're never going to know what my background's going to be, you're never going to know what the next guest is going to be.
That is true. If there's any reason to watch our show, check out Dr. Garcia's background because we never know what's going to be. I'm pretty sure for all the Chicago Bull fans out there, when we did the Lonzo Ball with the Bulls behind him, that was phenomenal. So, any last words as we wrap up the show?
No, just stay tuned. Put your requests in. We love the interaction. Like you said before, we're open to interaction. We're open to guest requests. We have had every little possibility of that, and I love the patients bringing it up too. So anything you guys need, let us know. We're happy for our listeners. Thank you.
Yes, once again, yeah. Thank you for listening, and Dr. Garcia, thank you for your time. Bye.